Hi, welcome to the final day of the All Age Transformation Access Week. Next you're going to hear from Sheila Giddins, who's one of our consultant psychiatrists in our adult mental health services. Let's hear about how she's found the week.
It has been quite challenging and hard work. It's clear that the people within the room are there for the benefit of the patients and have a lot of will in terms of wanting to make the journey of a patient right the way through from access to treatment easier. We've been dealing with access purely today, but with being mindful of where that leads to. And I think, all of us who are in there, and it come from a wide range of backgrounds, doctors, nurses, psychologists, users, carers. And we've all worked, I think, really hard together, thinking with a lot of respect actually from one another's point of view. But there are challenges to it, and there's a lot of things that we need to think about. And I think it's clear that there's already some really good things going on, actually, and we need to make sure that we maintain that within this framework that we're looking at.
And so for you in particular, what do you think are the sort of key challenges as a result?
I think the key challenges are going to be, holding ourselves in and not making the task that we commit ourselves to too big. I think there's a danger of us, because we want to help everybody, I think there's a danger that we're going to try and take things too far and then be disappointed. So that's the key, reining in and acknowledging that there are limitations, that we are, we've got to understand what our core service is really, so that we don't try and expand too much, take on too many roles that actually don't belong to us. And I think that's where we've been kind of trying to figure out the pieces of the jigsaw, who should provide what, where we can direct people to. I think we've thought a lot about it actually, and I think we've got the right pitch, but there's a danger that we might overstretch ourselves. And I think we've got to be very careful not to be reactive to things. I think that's what we have done in the past. We've tried to kind of put a sticking plaster, fix something and add it on to what we've got. It is right to look at a wider strategic longer term change, because ultimately that will last longer. I think at the moment we have some very good services, but what's happened is those services have developed and there's been a seeping of resources into those services, leaving the core group of people, which is actually managing the majority of the patients in need of mental health services with less resources. So I think that's really important to actually plan it over a period of time, so that we've got parity for all the patients and all the staff in terms of what we're able to give and what they receive.
And so another challenge we've had this week is around people knowing about the transformation. And we've had some challenge around people feeling quite worried that we're not including people. I guess, what would your message be about the transformation for our staff and for other people, about what it's trying to achieve?
Well, I think it's a starting point, and I think there does appear to be some publicity around the trust and invitations to input into it. And I think we have heard that through the focus groups. They've been brought in, so it's not that there's been focus groups and they've not been brought into the group to listen to the anxieties and think about the anxieties. I think it's natural for them to be anxieties around change, so that's just inevitable, really.